We face a year of great challenges.
Responding to a call from the World Health Organization (WHO) to adequately cushion and mitigate the emotional and psychosocial backlash from the COVID-19 pandemic, the Ministry of Equity, Social Justice and Empowerment is playing a lead role in beefing up St. Lucia's social support services. The latest efforts in that regard was realized this week with a 3-day training program that sought to equip community outreach volunteers from all 17 constituencies on St. Lucia in better managing the myriad of social issues plaguing residents within communities.
They will be getting training today on conflict resolution, substance abuse. For the rest of the week, we'll be focusing on gender-based violence, psychosocial support and mental health, and those critical areas that, we see issues arising within the communities. So those persons would be getting those skills in order to give support to residents within their communities. So persons in distress, persons who are going through whatever it is they're going through, they'll be getting the knowledge and the skills to be able to give some level of support and to make linkages to the various intervention agencies.
Funding for the latest training came from the St. Lucia Hospitality and Tourism Association, the SLHTA, under its Tourism Enhancement Fund initiative. With tourism being the main economic driver, employing thousands of persons and impacting the lives of even more households indirectly, the tourism body says it's important that not only industry workers, but community activists, volunteers and residents alike all get the help and assistance needed in ensuring that their mental and emotional well-being remains intact.
Persons are not keen to reach out to places like the crisis center because of the stigma associated with getting that psychological help. But with persons right there in the community that you can speak to, that could intervene, that could provide that source of an outlet, a relief for some of the stresses that we face, we found that that need was critical. So when the ministry reached out to us, we were more than happy to have the young persons being trained in those areas that they would be able to now be able to do conflict resolution, effective communication, give that peer support that is needed.
This initiative, I must say, has been enlightening. Most of the information shared is new to me, and I've been able to connect it to our everyday lives in terms of dealing with specific situations that we have in the communities, in terms of conflict resolution, and just to alleviate certain norms that we may have in terms of handling situations. According to World Health Organization statistics, on the heels of the COVID-19 pandemic, persons requiring mental health services rose 25% globally, hence the call for countries to strengthen their mental health capabilities. The 3-day February 6 to 8 training targeted approximately 50 individuals.